Good dementia care is good basic care. It's not rocket science in a lot of cases.
If we were to put our loved ones into a facility, how would we like it to be?
Hi, I'm Maria LaRose. Welcome to this dialogue on dementia, Keeping Safe, brought to you by WorkSafeBC. There are some statistics that you may not know. There are over 100,000 new cases of Alzheimer's disease and related dementia reported in Canada each year. So that's 1 every 5 minutes. By 2038, these numbers are projected to rise to over 250,000 new cases. That is 1 every 2 minutes. What has that got to do with us? Well, 50% of Canadians know someone with dementia. 25% of Canadians has a family member with dementia. But here's another statistic or another fact that's not very often talked about. Violence is the leading cause of work-related injuries sustained by long-term care workers. Violence. Healthcare workers are injured by acts of violence more often than law enforcement officers, retail workers, taxi drivers. That's something that I certainly didn't know before. So in the next hour, we're going to discover some facts about dementia, especially related to violence and aggression or violent and aggressive acts. And we're also going to explore strategies that help to keep everybody safe, the person living with dementia, the family members, and of course, the people who are working with the people with dementia. And joining me for this discussion are a group of people, each of them, this is a subject that is a part of their everyday life. Right to my right is Dr. Elizabeth Durrance, a clinical associate professor with the Department of Psychiatry at UBC. She's a medical director of the older adult program of the Vancouver Community Mental Health Services. She has a lot of experience as a geriatric psychiatrist in residential care setting. Welcome. And Jane Devji is a CEO and administrator of Delta View Campus of Care, and that is comprised of 292 beds plus 4 private assistant living suites. So that's a big facility. Welcome, Jane. And Nan Koldewin. Nan's husband, Frank, was diagnosed with Alzheimer's disease in 2006, and Nan and Frank have been married for 42 years. And before Frank's diagnosis, Nan worked full-time outside of the home as an administrative assistant, and today she's a full-time caregiver. But of course, she's also a mother and a grandmother and a daughter and a sister and a cousin and a lot of other things. So Nan brings that personal experience to this conversation tonight. Welcome, Nan. And Gordon Freeman has over 30 years of experience of providing care for the elderly. He currently works as a residential care aide with Providence Healthcare. He provides frontline personal care, and for those people who don't know, that includes dressing, toileting, bathing, and helping to eat to the elders at St. Vincent's Langara in Vancouver. Welcome, Gordon. And Tara McDonald is the coordinator of the Violence Prevention Program at Providence Healthcare, and that means that she's been instrumental in developing policies and procedures and education focused on the prevention and management of violence in healthcare. Welcome. So that's quite a panel. Nan, would you mind starting for us, just so that we understand more about dementia itself? What were the symptoms that you noticed first and that you noticed now with your husband, Frank?
I first noticed Frank's irrational anger that sprang very quickly for no reason, for putting the toilet paper roll on backwards, things like that.
And that was new and different from
It was new and, well, Frank had been angry with me before in the past in our 42 years, but this was really irrational and really flashed very, very quickly. He also had some slurred speech, and his balance was just a little bit off. Not a lot, not falling down or anything like that, but just funny little trips or imbalances.
Mm. So, Liz, what do we know about dementia? Are those symptoms that are typical?
Well, I think, it's interesting. Dementia presents in so many different ways. But one of the things that Nan is describing, that, unsteadiness of gait and the mood swings that can happen would perhaps maybe more be less typical of the most common form of dementia which would be Alzheimer's disease. And maybe more commonly, we would see that with a vascular dementia or a stroke-related dementia, but I don't know. I mean, it's interesting that, as I say, dementia presents in so many different ways. The anger and the sudden sort of flashes of anger are often the result of frustration and a sense that things are not quite making sense the way that they should.
In a minute, we're going to ask you to describe maybe all of the reasons that somebody who has dementia may behave in a way that's angry or aggressive, but just to help us more understand, what is dementia? I think it's one of those words that's got to be the least understood and the most misused in our language.
Well, dementia is an umbrella term for a group of symptoms that usually come together. They are symptoms that usually affect memory, other forms of thinking, our judgment. They may affect our ability to navigate and find our way around. They affect our ability to communicate. And eventually it affects one's ability to look after oneself. And one's social functioning, often leading to some of the behavioral symptoms that we see. So dementia is an umbrella term, and there are a number of illnesses that are dementias. So the most common form of dementia is Alzheimer's disease, followed by the vascular or stroke-related dementias. And then we have the less sort of typical dementias, dementia with Lewy bodies, and also frontotemporal dementias. So it's, dementia is a syndrome or a group of symptoms that come together, but it's not a diagnosis in terms of a disease.
And is it an old person's disease?
Well, it does happen more commonly. Growing older is the number one risk factor for developing dementia, but it also happens to younger people as well. And we see a fair amount of that in the 40s and 50s.
Jane, I see you nodding your head over there.
That's true.
Microphone.
I've seen younger people as old as 29-year-old with Lewy body dementia. And it's a horrible thing to see.
And so you talked about some of the loss of functioning. Was there anything else that in that list that we should know about? What are the things that happen?
Well, because Alzheimer's disease is sort of the most common form of dementia, we usually see memory impairment first, and usually it's demonstrates itself in forgetting where things are, or asking questions repeatedly, or simply forgetting details that were told to the person a brief time ago. So usually memories for things that have happened more recently are affected early in the illness. But associated with that may be word finding difficulties. So sometimes we all have difficulty finding words.
I was just going to say that, yes.
And that's not uncommon, but when it becomes where you notice yourself entering a conversation with someone and having to fill in the blanks continually, or trying to figure out what the person is trying to say, we call that expressive communication problems. So those are some of the things that we see earliest, along with some of the judgment difficulties. So people perhaps saying things that are out of character, or not looking after their finances the way that they normally look after that checkbook very, very well, and all of a sudden they're not paying bills, and they may know that they should, but they're just not actually getting that done. So early on, those are some of the things that we see.
Okay. So why are we having this conversation about violence and aggression in relation to dementia? Is there any reason to believe somebody who has dementia would be violent and aggressive as part of the disease?
Well, one of the challenges is when we hear the words violence and aggression, we often assume that we're talking about purposeful acts. That people are actually trying to injure someone else. But one of the key things that we need to remember with dementia is that the world doesn't make sense to the individual quite the way it did in the past. And the world can feel very overwhelming. So things that you and I take for granted every day, getting up, getting dressed, having a bath, any of that, can feel very, very uncomfortable. And depending on how people are communicated with, how they're interacted with, that can certainly provoke some of these responses, which are just saying, back off, I'm overwhelmed.
Okay.
There are other things too.
We're going to take a short break now, but I think this is where we're going to pick it up when we come back so that we can really understand what are we talking about when we say violence and aggression. What does it look like? And we look forward to carrying on that conversation when we return, so just stay with us. We'll be right back.